What is drug susceptibility testing, DST, for drive TB? Imagine trying to find the right key to unlock a stubborn lock. That's similar to what drug susceptibility testing does for tuberculosis bacteria that resist standard medicines. When someone is diagnosed with tuberculosis, especially if there's concern about drug resistance, doctors need to know which medicines will work best. That's where drug susceptibility testing, or DST, comes into play. It's a laboratory process that helps identify which tuberculosis drugs can kill or stop the growth of the bacteria, and which ones the bacteria have become resistant to. This is especially crucial for drug-resistant tuberculosis, or drive TB, because resistant strains can make treatment much more complicated and longer. In the case of drug-resistant tuberculosis, DST is performed on a sample of bacteria taken from the patient. The main goal is to see if the bacteria are sensitive to the drugs used to treat tuberculosis, or if they are resistant. Knowing this helps doctors choose the most effective medicines right from the start, giving the patient a better chance to recover and preventing the resistant bacteria from spreading further. There are two main types of DST, phenotypic and molecular. Phenotypic DST involves growing the bacteria in the presence of different drugs at specific concentrations. If the bacteria grow despite the drug, it means they are resistant. This method is considered the most reliable but can take several weeks because tuberculosis bacteria grow slowly. Molecular DST, on the other hand, looks for genetic mutations in the bacteria that are known to cause resistance. These tests can give results much faster, sometimes within a day or two, which is very helpful when quick decisions are needed to protect public health. DST is recommended for all confirmed tuberculosis cases, but it is especially important for people at higher risk of drug resistance. This includes those who have been treated for tuberculosis before, individuals who have been in contact with someone with multi-drug resistant tuberculosis, or people from regions with high rates of drug resistance. Early testing allows healthcare providers to tailor treatment plans specifically to the resistance pattern of the bacteria. For example, if the bacteria are resistant to the two main first-line drugs, isoniazid and rifampin, the case is classified as multi-drug resistant tuberculosis. If the bacteria are resistant to some second-line drugs as well, it may be classified as extensively drug-resistant tuberculosis. These classifications influence treatment choices because resistant forms of tuberculosis often requiring longer, more complex, and sometimes more toxic treatment regimens. Overall, drug susceptibility testing is a vital tool in the fight against tuberculosis, especially the resistant forms. It helps ensure patients receive the right medicines early, which improves their chances of recovery and reduces the risk of spreading resistant bacteria. Although the process can sometimes be slow and technically demanding, advances in molecular testing are making it faster and more accessible worldwide. This progress is essential for controlling drug-resistant tuberculosis and moving closer to ending this global health challenge. Always remember, if you or someone you know is dealing with tuberculosis, consulting healthcare professionals is the best step to get personalized advice and effective treatment.